tell you the story. And so, I'd like to first start with ask you guys a couple questions. First question is this is a quiz question I get to a student for my class. This is 70570 biology. I'm not going to sell our course to you. This is the question I get. I want to ask you guys opinion. So what is ALS? I know we gotta know what is ALS. So what is the challenge for developing effective therapy for ALS? Can I get some answer from you guys? What do you want to say? Yes, please, go ahead.
In most cases, we don't actually know what the problem is.
Okay,
so
good.
Some of it's familial and some of it's just sporadic.
Good. Oh, yeah. Yeah.
The onset of the disease, most of the damage is already done.
Yeah.
By the time you have symptoms.
Yeah. Yeah. Okay. So this is exactly right. You can see the complexity of this disease. They have a more than 30 genes. Mutation of this gene can cause ALS, right? And the other issue is, as you mentioned, when patients first visit doctor, there are more than 50% of motor neurons already died or died, right? So it kind of is the disease already turned on. You can go into the patient die, lose the motor neuron every day, right? And how can we stop it? And the other problem is, as you know, in the past 20 years, there are a large number of the potential therapy target on different mechanisms, and it work pretty well in this ALS mice, but it cannot be translated to human, and we don't know why. And some people say it's because animal model, because all this study use SOD1 gene nitrogen mice. Well, yeah, possible, but this is the only reliable animal model for ALS at this moment, right? As you learned from the previous lecture. And the other thing is, in my opinion, is maybe the initial cause could be different. Maybe it's a mutation in that gene, or maybe it's aggregation of whatever protein, TTP43, SOD1, and lead to motor neuron death. But eventually, the end point, the body, the disease state, and the disease state is a motor neuron death, right? So, how can we stop it? How can we stop it? It's challenging, really challenging. And so if we, the targeting the protection of the motor neuron from degeneration is still the best strategy at this moment, in my opinion. Okay, and which may slow disease progression and maximize quality of life. Okay, so if doctor tell this patient, so you will see 5 years left. Well, if this patient have a good life, within 5 years, that's very important for parents, right? All right, and then the second question I want to ask you guys, say today in the lab, or you find something when you activate whatever pathway of protein, or you inhibit whatever pathway of protein, and you find this provide significant beneficial effect to any of the animal model of ALS. And how are you going to do? Now you got an idea. I want to translate this basic finding to potential therapeutic. What's the process in your mind? Yes. No? Yeah, just say what you want to say. And yeah,
It's a very complex process to go from the lab to develop therapy.
Okay, the therapy. What's the process from the basic finding to the drug? No matter it's just a traditional drug or it's like a virus or gene therapy, whatever. So what's the process? Yes.
So you try to figure out maybe a drug or something that can work on the target that you think, and then you're
find the potential compound, potential drug, right? And then once you find potential drug, and then you make sure this compound, potential compound, is safe, right? This safety is the number one issue. Okay, and then you find, okay, it's safe, and then you test in the animal model. Say, maybe you test again in SOD1, G1, G3 mice, and you see significant beneficial effect. And then you say, okay, does this compound, this drug, can be used for human? Or just for mice? Okay, now it's move to the next step. Develop your drug for human use. And before you enter the clinical trial, so you need to test in the higher monkey or dog, right? You right? And what else? You got the cut idea now. What else in this process? Any other important factor? It's obvious. Your compound drug need to be attractive. So people want to put money on your development. So money, number one. Right? If we have money, we cannot work. So now, so you want to get money funded study. So your drug, your compound, your idea need to be novel. It need to be people feel excited, people be acceptable to the community, right? And then you got the funding you develop, and then during this process, the other important factor is like me, I'm a basic researcher. I don't know how to do a drug. You need a chemist. You need the people who can help you to commercialize your compound. Right? And you need to bring the team together to develop this potential drug. Okay. So you need to be a good salesperson, which I'm not. You need to be a good how to say, good thinker. You need to say, okay, if this drug works, what I want to do next, and what kind of person I need to bring in, what kind of money I need to bring in, and this is the process. And I'm going to spend about half hour or 40 minutes to share my experience with you. Again, I'm a basic researcher. I want to tell you how did I develop this to our current state. Okay, we don't have drug, okay, but just tell you the. Okay, so this is the pipeline for the. So you have idea. Okay, you want to shut down. You found the shutdown protein or violent pathway provide beneficial effect. Okay, and then you need to build the acid. You need to find the compound. Okay, in vitro. This needs to be in vitro acid, simple, reliable acid. After that, then you screen the library, you screen million, hundreds of compound, and then you find the potential compound for your purpose, right? And then after you got compound, you need to test the safety, as we mentioned earlier, and then you need to test your drug, your compound in the animal model disease. So proof of concept, right? And once confirmed, and then you need to develop your drug for human use. So you need to optimize your compound. Okay. So this is called the de-optimization. And then after that, there are a lot of high-level toxicity assay study need to be done, and then you select the best candidate. Okay. And then in that best candidate, then need to follow, then you need to present your best candidate to the FDA. And then they will tell you how to develop the called pre-IND study. And then you got the the end you provide the IND application to FDA, and then once they approve, and then you need to so you can get into the clinical trial. So this is a long process. Think about, and it's high risk. It's low process, high risk. It's meant for any time. Okay. All right. So now I'm going to tell you my story now. So we study a protein called glutamate-mediated. I guess I believe you guys are familiar with new basic neurobiology. The neuron communicates through this transmission, right? And there is the other cell. You may know the astrocyte. This is a cell surround this neuron and help provide play a critical role in neural function. And so one astrocyte they have a process that touch to many different synapses. Okay, and then so one neuron usually can take care of about hundreds of this synapse. Okay. So it may be this synapse has a very strong activity, synaptic activity, and this synapse doesn't need a strong synaptic activity. Okay. And there is one protein which I have studied this for a long time. It's glutamate transporter AT2. So the function of this transporter is basically, so now we look at this area here, okay? So this is neural communication. This is a presynaptic terminal here. This is postsynaptic terminal here. So this is at the process from exercise. So when for this glutamatergic neuron, when glutamate release, glutamate binds to the glutamate receptor, activate this neuron. This is how they communicate, right? And so this glutamate needs to immediately clean from this synaptic strip by this protein. Okay. If this one malfunction, it will activate this one. And people know for a long time, this called glutamate-mediated excitotoxicity. Damage this neuron. And this toxicity has been playing a critical role in many neurological disorders. Okay. And so now I can't tell you what's our protein. Okay, we are working on. So let me just go quickly about the importance of this protein. So this EAT2 is localized on the perisynaptic process of exercise, closely associated with the excitatory synaptic contact. And it plays a critical role for maintaining low extracellular glutamate concentration and preventing excess glutamate-mediated toxicity. It also plays essential role in regulating synaptic toxicity and cognitive function. Okay. If you enter this, you go to online and look at search this literature, and you will find hundreds, thousands of the paper. And I just want to tell you some information, show you why people consider this is the potential drug target, therapeutic target. The first information I want to tell you is so mice, if you knock out this gene, this protein expression drug, and you it causes too much glutamate and lead to the seizure. So these mice usually die very early age, at a very early age. And then if you the mice lacking one idea for it to show worsen outcome about SCI, TBI, or stroke. So one idea may be worse. It makes sense because under the SCI, TBI, stroke, there are a lot of glutamate release and those kill a lot of neurons. They play a critical role in this disease. Okay, in mouse model of ALS, SOD1, gene addition mice, I already mentioned, they keep the one idea for EAT2 exist earlier onset and death. Okay. In Alzheimer's, in the mouse model of Alzheimer's, this model, electing one idea also exists accelerate the cognitive deficit. Okay. And if you block the EAT2 function in the prefrontal cortex, it inhibits depression symptoms. So, as you know, prefrontal cortex modulates our mood. So this tells us EAT2 play a role in this depression or anxiety. And the other thing you can find in the literature is people show that EAT2 contribute to the pathophysiology of alcohol and the drug addiction. Okay, you can see all kind of the neurological disease associated with this gene, this protein. And now because this is ALS, this class is about ALS. I just want to show you. You may know that this protein, people have really reported this protein significant decrease, loss in this ALS patient in the motor cortex or in the spinal cord, and this is with the price of that is standing, this is the model. And the other, you also can find in the literature that people show that when they active upregulate this protein expression provide a significant beneficial effect in many animal models disease. Is that this here? So about 10 or 15 years ago, in many laboratories or companies, they will try to find a compound which can activate EAT2 expression, and because this is a potential therapeutic approach. And so now back to my when I speak at the beginning. So when you come up with an idea, you need to have a strong literature evidence to support your idea. So people will buy your idea, put the money on your research. And then the other issue is your idea is people all think about, but you need to present a novel, different to other people's idea. What I mean idea, I'm going to tell you in my following slide. Okay. All right, let's back to okay. Now this is you guys may know this excitotoxic. So maybe I just mentioned many laboratories or companies they try to find the drug which can activate this EAT2 expression. So in 2005, Dr. Jeff Rustin and John Hopkins he identified this excitotoxic which is a beta-lactam antibiotic, and he showed that it can increase EAT2 expression through the transcriptional activation. And people were excited, and people tried this excitotoxic in different animal models of disease, and it showed very nice effect. And so, a couple years ago, so there was a big clinical trial for ALS, excitotoxic in ALS. But this trial was stopped because the pre-efficacy determination was not reached. So it doesn't work. Basically, it didn't work, so it stopped. And so kind of people okay, so EAT, increase EAT2 is not maybe it doesn't have a therapeutic potential. But there, after that, they have people come and say, oh, well, I don't think excitotoxic is the right drug for this purpose. Okay, and because people say that they were not able to increase this EAT2 expression by this drug in vivo in some of the animal models. For example, this is a SOD1 G93 spinal cord, it's normal. And this is SOD1 at the disease stage. You can see this EAT2 protein significant decrease. But if you inject excitotoxic directly into my spinal cord, just directly, there's nothing, no other issue involved. It doesn't activate EAT2 protein expression. Okay. And people also concerned that well, there's no biomarker for EAT2, and people don't know whether the EAT2 is really upregulated in those patients who receive excitotoxic. Okay. And so excitotoxic was very hard, but after the trial it was dropped, but still people concerned with this issue. Okay. And now I'm going to talk about our project. Okay, so in around 2007, my lab we found this EAT2 mRNA has a very long 5' untranslated region before a stem loop. Okay. And expression of this EAT2 mRNA, or I should say translation of this EAT2 mRNA, is highly regulated at the translational level. Need the activator to stimulate find that the resonance, and when we get the resonance into the culture, it's a technical translation. Okay. So EAT2, especially EAT2, is highly regular at this translational level. It makes sense. Think about if you let's come back here, look at this slide. Say, this synapse maybe has high synaptic activity and need more EAT2. And this synapse maybe has lower synaptic, doesn't need higher EAT2. And this synaptic activity is very dynamic. So it makes sense. So especially EAT2 regular at this translational level. So needed produce, not stop. Okay. And then we find that maybe this play a role in here. So at the disease stage, the neuron is dying, and synaptic activity is going down. So protein doesn't need it, it's going down. But saturation cannot be caused. And but you may ask me, well, so if this is consequence of disease, it's not important. Yeah, that's true. But think about this way. Okay, if this synapse activity is decreased, EAT2 goes down, but it cannot uptake glutamate effectively, and then glutamate will spread out, and this will lead to more excitotoxicity. So people believe this could be the propagation factor. Okay, so if we can restore this protein, like restore to here, we may be able to at least block this excitotoxicity pathway. Again, this is just one of the contributors to the disease process. We should not expect this to cure the disease. And as I mentioned, my first slide, early slide, I mentioned that our goal is to slow down the disease progression, slow down the motor neuron death. Okay, so patient has better, can a few months or years or better lifetime. Right. All right. So that with this finding, and then I come up with the idea. I said, maybe we should find some compound which can activate this EAT2 translation, and then let's see whether it can help people. And so I asked the people around me OSU. I said, I'm a basic researcher. I don't have any idea how to figure out this, but this is my idea. I need a chemist. I need a person who knows drug discovery and development. I couldn't find one. So I went out and I find okay. And I find a collaborator, my current collaborator, who is in the Harvard Medical School. So they are the drug discovery laboratory. Okay. So I contact them, and they like idea, and so I send a postdoc over. And then my postdoc, then let me come back here again. So our goal is to search for compounds that increase EAT2 translation. So my postdoc, the vision for my postdoc is to establish an assay, okay, and simple, reliable in vitro assay, and which we can screen compounds that can increase EAT2 translation. So he spent about 6 months, and he established a cell-based ELISA assay of this here. So this is my collaborator. So for laboratory for drug discovery, neurodegeneration, and Harvard Medical School. Okay. So my postdoc established took about 6 months to establish this procedure. I'm not going to detail about this. And then he So from the 6 word plate, 24 word plate, and then go up 96 and 384 plate, and so and repeat, make sure the assay is reliable and reproducible. And then after that, then he performed the high throughput screening. Okay, and he slept in the lab for 3 weeks just for this. So he brought a whole bunch of the culture, and then just at the same time just routinely screen and with their facility, which is the robot system. You can see, and so after this high throughput screen, and then he screened 140,000 compounds, and then 293 compounds were considered hit. After that, he did a 3-point dose assay, and then 12-point dose assay, and then come up with the 61 compound, which showed dose-dependent activity. And then the chemist, my collaborator chemist, he grouped this 61 compound to 16 unique structural classes. Okay, now we have 16 classes of compound which can activate EAT2 translation. Okay, now we have got now it's here. 16 is here. It's too much. Right? Too many. That's impossible for us to handle. So the chemist he selected this 6 in gray. These 6 classes he will have potential drug potential, and then we establish an assay. Okay, what assay we have? The procedure we have is we test the compound in the primary exercise first, and then in the primary neural exercise mixed culture. So this is now more vivo, and then we test it in the mice. Now I'm going to show you one of the compound, the result for this 3 steps. So this is the one of our compound. You can this compound in the primary exercise. You can see the dose-dependent increase the EAT2 translation activity, and then this can increase EAT2 protein expression within 2 hours. Actually, when we add the compound into the culture, just within 10 minutes, the silent EAT2 mRNA will become active mRNA, and then start to produce protein. And then the induced protein has a function activity, and then this is show the express induced protein is localized to the right place of the plasma membrane. So this is the primary exercise. And again, so we look at EAT2 mRNA, so it doesn't increase EAT2 mRNA level. And then we look at this called the polyvagal assay, and we see that once we add compound into the culture, and this the silent mRNA become active and then produce a protein. And the compound does not affect the half-life of the protein expression, so it's to activate the station. Okay. And this is with this compound in this primary neural exercise culture. You can see the add the compound into the culture, increase this protein expression, increase the glutamate uptake. And so in this culture, we also test confirm our compound to have anti-glutamate or prevent glutamate excitotoxicity. So we add glutamate into this mixed culture, and without compound, there are a lot of pH release indicate the cytotoxicity. So we add the compound to prevent significantly reduce the pH release. And if you look at the neuron, you can see this is a control. We add the glutamate to kill the neuron. If we treat with compound, and then prevent the neuron death. And then if we treat the compound plus the DHK is the EAT2 blocker. So if we block the EAT2 expression, the function, and so this is in primary in the primary mixed culture, and then after confirmed, so primary astrocyte culture, primary neuron astrocyte mixed culture, and then everything confirmed, then we look at the mice. And so because we don't know the pharmacokinetic property of this compound, so what we did is we inject the compound directly into the spinal cord, intracerebral injection, and you can see the this is one kind, this inject with the vehicle, and this inject with the different compound. And we also look at whether this causes the neuron death or cause the glial activation, and some compound did cause the neuron death, some compound is toxic, and so we eliminate those compounds, and so this is the next step in the mice. And then after that, we want to make sure our compound is able to restore EAT2 protein in SOD1G93 mice. You can see here, this is a West again. So this is in the spinal cord. This is one-time mice. This is SOD1 mice inject with the vehicle. So use EAT2, and then inject different compound. We were able to restore the EAT2 protein. It's just one injection, and next step we harvest the mice and analyze it. This is study, and this is by Western blot. You can see the loss of EAT2. We were able to restore by EAT2 protein, especially by this compound. And this also suggests that loss of EAT2, it could be due to this translational activity increase at the disease stage, and our compound was activated this process. All right, so after this 3 steps, and then we narrow down to these 3 serial compounds, and this 3 serial compounds will show strong activity and not toxic to the culture or to the mice. And but 3 toxic to mice, especially for this academic laboratory, that is impossible to focus on 3. And then I discussed with my collaborator, and then he looked at structure, and then we decided to focus on this one. Okay. So the rest of talk will talk about this series. Okay. So we after we got compound, so we need to understand this compound. So we did preliminary de-optimization. We will need to know what happens if we replace this chloride, or what happens when we replace alpha. So what is the function for each group? Okay. After we got this information, and then this, of course, we generate many analogs to obtain all this information and to get a better compound. But this is the preliminary de-optimization. The purpose here, we want to get a better compound for us to test in mice. The other purpose is so we can get an idea, and we can apply, when we apply the pattern for our compound, we can cover majority part of the potential modification. Okay, because so it's kind of protect us protect us this project to moving on. Otherwise, company or special company they feel they find this interesting, they can jump in right away. So then we submit the patent. I'm not going to detail about this, and then we cover all this disease being presented in the literature. And right. So after we got the protection, and then the next step we did is we need to understand this compound further. And so we select one of our compound, then we perform this pharmacokinetic, pharmacodynamic, in vivo toxicity, selectivity, in vitro profile, and then see how this compound safe, how this compound, what's so this is just show you this compound. This is a pharmacokinetics. This is inject the compound into the mice IP, and look at the compound concentration in the brain and plasma. And this compound did penetrate blood-brain barrier and stay in the brain. Actually, it's a brain to plasma ratio 2:1. So it's a good neurological drug. And then we look at the EAT2 protein expression. You can see this after you inject the compound into the mice, 2 hours, 8 hours, 24 hours, you can see the increase of protein expression significantly. And this is the glutamate uptake function, including glutamate uptake function. Then we also did the dose response, vivo dose response, and glutamate uptake. So, and then toxicity. Okay. So we spend, this is quite expensive. We spend money. Ask the company carry out this experiment. So they did a 5-day repeat dose. So basically to inject different dose every day for 5 days, and then look at the different criteria. Okay, I'm not going to go through here. And then they the report said no any adverse effect for observed. That's good. So, but we are not so trust the result. We yes.
Back to the list, you go back on that. Is that the order in which you like to do these things? Like efficacy studies, that's after
Yes.
PK?
Yeah, we need to have an idea how to treat the mice. Yeah, what dose we should treat them. How often we should treat the mice. Okay. And we need to make sure compound is not toxic in vivo. Okay. And we also need to make sure the compound does not cause a significant side effect. Otherwise, it's difficult for us to evaluate our outcome for our efficacy study. Okay. And this is kind of the typical, as I know, typical way people go through this, and then they got all information and then look at the efficacy.
So in the ALS world, because I know in the muscle dystrophy world, the gold standard for a small molecule would be to improve muscle function. What's the gold standard for a drug in the ALS world?
Survival.
So that's ultimately what you have to see is the improvement in survival.
Yeah, onset and survival.
On the SOD1 mouse.
Yeah, I will show you. Okay, so okay, so my postdoc, she didn't feel confident about this 5 days toxicity, and she said I want to make sure it's right. So she did I think it's about 60 days. Yeah. So she treated mice with this compound at 14 mg per kilogram for 60 days, and then look at the body weight and all of the things she looked at. So at the end, she looked at the storage, and then she found, okay, that's good, no toxicity, and then she feel comfortable carry out the efficacy study data. Okay, and I want to mention this as a selectivity study, so we have to perform the individual side effect profiling. So this is basically to look at the side effect. And then also look at the protein kinase profiling to see whether this compound active an alpha kinase and now a control like that. And so specifically, we often receive this question: is your compound activate induce a global protein synthesis or just specific EAT2? So we did the preliminary proteomic analysis. We only find, besides EAT2 includes about 2-4 in this experiment, we only find a few protein slightly upregulated or slightly downregulated. Okay. But they may have protein, we believe so. Their protein is also upregulated with EAT2. But we haven't identified yet. But our compound does not cause global protein synthesis, that's for sure. Okay, now the important thing is the efficacy. The proof of concept that our compound work in the disease and provide beneficial effect. And as we know, I mentioned earlier, there are so many well in mice and cannot translate to human. And so, but we don't have any choice because this is the only reliable ALS model at this moment. So we basically went ahead and then we follow the guideline, the copy number, interment match, follow all the examiner were provided, and most of the study they only use about 12 mice. We also use double mice. Actually, it was performed by two postdocs independently. Okay, and then we come out this result. So we just look at the motor function. Okay, and this why. So we treat the mice start from their early symptomatic stage when their motor function loses about 10%, about 5 to 10%, and the majority of mice were treated around 84 days. Okay, and then so this is the vehicle, and this is this compound. It delayed the onset for about 14 days for female. For male, about 10 days. And we also look at body weight. You can see this is the vehicle. It's a compound. It's still growing, and at a certain point it starts to drop. And this is the male. Okay. And delay about 19 days. And this is survival. And so female. And this is male. And so I just want to show you this is a typical female mice we observe. These two are interment. And this is a mice at 126 days old. This mouse died next day. And this interment survived another 3 weeks. And the majority are female mice. And then after all this, we harvest the tissue, and then we look at the EAT2 protein expression. It does restore EAT2 protein expression function. And this is look at the motor neuron by crystal virus staining. This is a vehicle. This is the SOD1 mice with vehicle. SOD1 with vehicle. This is the majority of motor neuron gone. And this is the SOD1 is treat our compound. And this again, we look at EAT2 wild-type mice, decrease in the SOD1 mice to vehicle, and then restore in the SOD1 during this compound. Yes.
So at what point of the disease these features are taken?
Oh, this is 120 days. Yes. Okay. And then here I just want to show you I mentioned early slide, ceftriaxone. This is ceftriaxone. It's a big molecule. Actually, it's not easy to get into the brain. And this is our compound. And if you look at, so this one is ceftriaxone. The EAT2 expression in the ceftriaxone treated mice and our compound compared to our compound. So ceftriaxone, we treat the mice with 200 mg per kilogram. Our compound is 40 mg per kilogram. I show you guys this already. So decrease ceftriaxone does not restore EAT2. Our compound will restore. Okay. Right. So after we finish the SOD1 mice study, so and we build because excitotoxicity play a critical role in the acute condition like epilepsy or stroke or spinal cord injury, trauma, this kind. So we test our compound in this Pilocarpine-induced status epilepticus mouse model. I'm only one slide. I just want to quickly tell you that. What we find is it reduced significant fetus epileptic. Okay, and this mice pretty bad seizure, and then for about 1 hour, and mice will come down. And then about 2 weeks later, and they will develop a chronic seizure. And once mice develop a chronic seizure, there is no drug to cure the chronic seizure. Because during this 2-week period, a lot of neurons die, the brain structure will reorganize, reorganize. And so we find our compound was able to prevent reduce the neuron death. Okay. And then, so therefore, can reduce the chronic seizure. I'm going to detail about this. And the other we look at is the we look at the Alzheimer mice. Okay. This Alzheimer mice is this mice develop the cognitive functions decline around about 5 months old, and then we treat the mice at the 7 months old and treat for 2 months, and then we look at the short-term memory, long-term memory, learning function, and then we find our compound was able to restore this memory function. I'm not going to detail. Okay. And right, and then this efficacy study looked good. So when we submit our the grant application to NIH, and we always have trouble. People ask, what is the mechanism? What is the compound target? So we compound by the whatever protein, and then whatever, and then eventually it's into expression. So basically, all we know is end product. What is the mechanism? And the reviewer always criticize this, and we have trouble to get the funding to continue study for this drug development. But on the other hand, it's very important for us to figure out the mechanism, because this mechanism may play a critical role in the normal brain function, right? And so, and then I'm going to tell the story. Basically, it's about we find when we add a compound into the culture or inject into the mice, we activate PKC pathway. And activates being PKC beta 1. And PKC beta 1, but we don't know the target. So compound into the cell, bind to whatever. And this whatever activates PKC beta 1. And this PKC beta 1 activates maybe different kind of RNA binding protein. And we have identified one of RNA binding protein is YB1. So YB1 binds to E82 mRNA is 5-part untranslated and then facilitates the translation. But we're still working on it. We want to figure out what the process is. All right. In addition, we found our compound also have other functions. This is discovered by the other faculty, the postdoc. Then what he did is he just culture, and then he treat the culture with H2O to induce oxidative stress. And he found if we treat the culture with our compound, we can prevent the H2O2 induced neuron death. And so I'm not going to, and then later he found it's because our compound was able to reduce ROS, the free radical. And so he inject so he looked at the SOD mouse at the pre-symptomatic stage. At the pre-symptomatic stage, about 60, 70 days old, the mouse has increase this RNA oxidation, one of the oxidative damage in this motor neuron. So if he treat the mice with our compound for 5 days, and then he look at here, and he significantly reduce this RNA oxidation. And then later we found out, it turned out our compound also can activate AKT. Okay. And then AKT somehow activate NRF2, and this NRF2 can activate a group of And then so we count the wall, and then so we can't finish the mice study. We know our compound work for mice. Now we don't have a compound for human yet. Right? Now what we are doing now is we focus on the optimization. We want to develop a better compound for human use. Remember the compound I present to you. We need to treat the mice. We need to treat the mice with 40 mg per kilogram. That's we cannot do that for humans basically. So this is the compound I show you, the data I show you. That's our early compound, and this is our optimum compound. If you look at the EC50, so EC50 for this whole compound is 1.8 nanomolar, and so our new compound is only 39 nanomolar. Very important compound. And if you look at the in vivo data, this compound, you can see the by IP 40 mg increase about 2.4. By kilo, increase about 1.5 or even less. But this new compound, okay, you can see increase 564, okay, and even can do 5 kilo. Okay. So PO is important. PO is this oral treatment. So this is just a IP injection, and this is an oral injection, oral treatment. So what our goal is to get a compound we can treat for the oral treatment, and we want to. Our goal is to increase EAT to about 2 to 3 fold. Our previous study showed that too much is trouble. What we need 2 to 3 fold, and by oral, hopefully it's about 5 or 10 mg per kilogram. That's our goal. We are very close to that now, and so. All right, and then the other focus is we need to identify the target. As I mentioned earlier, we don't know we know compound activate PKC and beta vivo and other proteins, but we don't know what is the compound target. So now we are trying to pull down, generate the probe, try to pull down what is the target protein. Okay. All right. So the last two things I want to mention, actually I already mentioned at the beginning. So this kind of drug discovery project needs teamwork. Again, I'm a basic researcher. I don't know the drug discovery development at the beginning. Now I learned a lot. And I need a chemist. So we have two chemists, excellent chemists. They know how to modify, optimize the compound. And we also need a clinician. And you may know Dr. Bob Brown. He's well-known ALS researcher and clinician. He quite supports this study. And the other thing I want to mention is for drug discovery, you need biomarker. So when you drug reach to clinical trial, you need to have a way to evaluate whether your compound work or not. Again, it's kind of the proof of concept in human, right? So you need a biomarker. Fortunately, we have a two collaborator. They have successfully developed EAT tool PET imaging. Okay. So kind of the imaging about biomarker is there already. So kind of we are in. So we are in around here. Around here. Okay. Probably next year we can find the best compound and then again the preclinical study. And the other issue, the other challenge for this kind of drug discoveries, as I mentioned at the beginning of my talk, is money. Without money, we cannot do anything. And it's very expensive for this kind of drug discovery. And so, unfortunately, we got some money from International Total Foundation. And again, the most important people that did the job. Okay? And this here. form, and there is a negative feedback mechanism. So it will shut down this protein. Or it shut down degrade this protein. Okay. That's the problem. It also makes sense. So if you come remember I show you the early slide show that why these EAT2 need to be regular translation because it need quickly increase or quickly degrade, right? Because the synaptic activity is very dynamic. Quickly degradation is through this degradation pathway. So when we reach to certain threshold, it's a turn on this degradation pathway and the protein is done. So that's the issue. Yes. Okay. Thank you so much. Yes.
So how does the protein become downregulated during ALS?
Oh, okay. I mentioned briefly earlier. So we think although many people feel this way is because this EAT2 protein is surrounding synapse, okay, neuron, and so when neuron is dying, sick, and then so its activity is decreased, and this protein goes down because it doesn't need this protein, okay, because it doesn't need the transmission process, so this protein dramatically goes down. Right? But mRNA is still there. It goes down because we don't know what's the factor. We are trying to identify what's the factor. Shut down this. Turn off this translation process. Actually, so at the disease stage or certain stage, or like when the synaptic activity is low, they have a pathway to come to turn off this translation activity when needed, and then it turn on. And our compound just hit that turn on pathway.